You're listening to Darling Shine, a podcast by Ellidy and myself, Chloe Fisher.
Darling Shine is your survival kit to the unexpected shit life throws at you.
This episode is brought to you by Healthy Nourished Soul, a beautiful cookbook and journal that will nourish your mind, body, and soul. It's the perfect book for yourself or a gift for a loved one. It will fill your mind with inspiration, your belly with wholesome, healthy food, and leave your heart bursting with love.
This book literally makes me drool. Sally is amazing. This book beams with pages of delicious recipes for raw treats, tea blends, beauty products, as well as journaling prompts and heartfelt quote pages. It's so cute and it's a perfect dose of self-care and wellness and all that we need in our lives at the moment, really. Darling Shine listeners can use the code DarlingShine for 25% off store-wide at healthynourished.soul.com.au. This is actually the best present to give as a gift to your friend.
I know, my mum bought them for my sisters for Christmas. It was a vibe. Hello, everybody, and welcome to episode 6 of Darling Shine. Oh my God, that means we're halfway through this season. What the hell? And it's taken us halfway through this season for Britt and I to realise that we need to tell Ellidy we need to give ourselves at least 30 to 45 minute buffer when we're going to be doing recordings, because she definitely comes right on the dot, and that doesn't mean we got to hit record on the dot when we want to record. Whereas
we
needed to
half an hour
be
late,
here at least half an hour earlier. So now when we need her at 9, we're going to say we need her at 8, and then we'll probably see her at like 5 to 9. So I've learned that. She's also just done a quick drop and run with Minnie. Poor David, her brother.
My poor brother. I've just like literally drove over and just dumped Minnie on his doorstep basically, and she was just screaming, and he's like, so what do I do? This is basically his first time looking after her. I'm just like, there's a bottle, there's some nappies, there's some wipes, you've got this.
Has he ever checked before?
Yeah, he has. Yeah, but he did just text me and he goes, she's already soiled herself. I'm like, sick, I don't care. She does that 5 times a day, so change it.
Oh, so
change her little nappy. I think he does a bit of a boy job. Like
no.
I don't know. He's just like, so front to back wiping, and I'm like, yes. Front to back, not back to front. Yes. And then the nappy comes on, and then you lift out the little inside bits of the nappy so she doesn't shit down her legs.
That movement when you do that.
Just yeah, I mean, look, I don't muck around. Just get the nappy off, wipe her ass, put the new nappy on. No, simple.
No muck around, Minnie.
No muck around, Minnie. But yeah, look, it definitely just getting from like just the front door to the car is like takes like 7 hours at the moment.
Yeah. We'll get better at that.
Yeah, I can't imagine. No, I don't think we will, because she'll become a toddler and I'll be like, now we have to get food, and like
wrangle
now her walking will be like all slow and stuff. I just have to pick her up.
Well, anyway, today's episode we spoke to Jess from our acupuncture clinic, which we are obsessed with. We spoke about all things women's health, fertility, traditional Chinese medicine, acupuncture. Very, very excited for you guys to hear this episode. We learned so much about more stuff that we even we thought we knew everything, but we obviously don't.
We know nothing, mate. Don't be silly. Yeah, this was such an insightful chat. Jess is a legend. She actually owns the acupuncture clinic that both Chloe and I go to here on the Gold Coast. After graduating in 2011, Jess took her practice overseas to Central America, Asia, the Middle East and Europe. And then she established her own clinic in England, which she worked in for 3 years, treating a variety of conditions using Chinese medicine, acupuncture, herbs, and massage.
Busiest boy on the block, hey?
Busy boy. Have you had one of her massages? They're off the chain.
Well, I've only ever had the massage and acupuncture, but I need to get just a full-blown massage.
She's insane. They're hard to get into, girls, but I'd say, Nüwa on the Gold Coast. So during her career, Jess has always had a passion and interest in fertility, acupuncture, IVF, acupuncture, and women's health. She's developed her skills and understanding in these areas by taking on post-grad education, as well as attending numerous workshops to further expand her knowledge. So we are super lucky to speak to this absolute wizard. She moved back to Australia in 2015 and opened up Nüwa, which is the clinic that we go to, and is currently completing her master's in reproductive medicine and Chinese herbal medicine while also running the clinic. So yeah, busy boy, as you said.
She's so smart. Love Jess. We can't wait for you guys to hear this episode.
She's a lord. All right, let's go.
All right, so welcome, Jess, to the podcast. We're so excited to have you on here, finally.
Thank you.
So today we're going to talk about all things women's health and fertility in sort of through the lens of Chinese medicine. And we speak about this a lot on our podcast, and we thought that there would be no better person to get on here than both of, I actually don't see Jess, but Ellidy's been seeing Jess for a few years, a year or two.
She's epic. Yeah, I've been seeing her. Like, you know, when Chump was alive and we were trying for a baby, I came to you, Jess, and so you were helping me try to conceive and doing all those things, which we're going to get into in this podcast. But it's like since Chump's been gone, I've just come to acupuncture, and it's not even for health anymore. It's just like a therapy session because we have such good chats and stuff, and Bonnie as well.
I'm the same.
Yeah.
Bonnie's like, relax. Bonnie works out of the same studio, and I feel like I just go there for a chat now. Bonnie's been like by my side since the very beginning of my journey, like knows it back the front.
Yeah, I feel like I don't need a doctor anymore. You guys are just like my health, all my health shit in one place.
So this sort of like this whole sort of topic sort of evolved from myself thinking a few weeks ago, like, all right, I want to sort of put together a bit of a workshop. You know, when I first started trying to conceive 2 years ago, I knew zero about fertility. I knew zero about our reproductive system. I honestly knew nothing. I just thought that like it was just a thing that happened, and then like you fell pregnant and Bob was your uncle basically. And then I guess I kind of a few weeks ago was talking to the girls who run my local yoga studio, and I was like, can we do a workshop? I'd really love to like curate something that I wish I had when I first started, and just like learning about the ins and outs of your cycle and everything to do with acupuncture and fertility and Chinese medicine when it comes to trying to conceive. And so Jess got brought on board, and we had that about 2 weeks ago, and honestly it was so beautiful. And I'm all about like women's circles as well, like finding women in the area that are going through the same thing, because it's something that people do not talk about. We speak about this a lot on our podcast. It's a very unspoken thing. Some people don't feel comfortable talking about it at all. And women that came to this workshop, we're all on different walks of life. Some women are just thinking about having a baby. I obviously am going through IVF still. There was women like that weren't even wanting to have a baby, people that were actually coming to learn what not to do to fall pregnant. So they were basically just doing everything opposite to what Jess was teaching.
Wow.
But it was just like emotional. We started the workshop. What is that flow thing that we did? Because I actually don't know how to pronounce it.
Oh, the Qigong. Yeah. So one. Ashley led that one, which was, I think, very different for most people there. I think everyone had done yoga, but only like one or two people had done Qigong. Yeah.
Yeah. It was so cool. Cause like I think I was only like a week out of, no, I had my wrist surgery only a few days before. And I was like, I don't think I'm going to be able to do anything, but I was actually able to do this. And my mum even came to the workshop because she was up here with us, and dead set, I'm not even kidding, by the end of that movement session, I like looked up, I'm like, she was on the other side of the room to me. I'm like, are you okay? And she was bawling her eyes out, like literally bawling her eyes out. She was just, I was like, what is up? Like in the end, she's like, I'm just like so emotional. There's all these women in this room that are trying to conceive or that are struggling to conceive. And I just feel, she has like a lot of empathy, mum, and she was feeling all the feels. She's like, honestly, I could not stop crying. Tears were just running down my face. It was really, really beautiful. So that's where this has kind of come from. And like, I'm so excited to have Jess on here. And yeah, we're going to talk about all things Chinese medicine and fertility and acupuncture, and we're so excited.
It's good. Yay. I'm glad you enjoyed the workshop. It was a good kick up the bum for me to put together something in a very short period of time, but I needed it, so it was good. Thank you.
That's so cool. I missed out. I wish I was there. I wanted to start by talking about Chinese medicine as a whole. I'm just super fascinated in Chinese medicine and like the herbs and the tinctures. But where does acupuncture fit into Chinese medicine, like as a whole?
So when we look at Chinese medicine, it is an all-encompassing health system. So the Chinese medicine, I guess the whole part of it is you've got not just acupuncture is obviously very well known in it, but you don't just have acupuncture. That's kind of like your body work. There's also tuina, which is like the massage, and other forms of acupuncture, maybe like Korean acupuncture or Japanese. They also have forms of massage too. So there's the bodywork components. And then you've got things like diet, lifestyle, herbal therapy, and then movement therapy. So you experience Qigong, even in Ayurvedic medicine. So you've got yoga, and they have the same sort of system. So it's this Eastern systems or medical systems are kind of all-encompassing. They don't just look at one facet in an area. It's everything. And that's, acupuncture is one of the, practical modalities of it. So that's how I guess it fits in. But the way that we treat here, and a lot of acupuncturists treat, is yes, there's acupuncture, but there's also lifestyle, diet, herbs, and then movement therapy, breathing, that kind of thing. So it's just one part of it.
Oh, it's so fascinating. Seriously, I feel like every time I get acupuncture, and at the moment I'm getting it literally once a week. Oh, actually, I've been getting it almost twice a week with Bonnie. And every time she does something to me, I question it. Like, I'm like, okay, so what is that point? What are you doing here? You're feeling my pulse. What are you actually feeling? Which is, and I drill it every single time, and I learned so much. I'm obsessed with the whole, like, everything involved in acupuncture. It's so interesting to me, and I'm just getting used to taking Chinese herbs. When I was in the States, the acupuncturist, when I was doing my round of IVF, was giving me all these like different pellets basically, and you have to take so many Chinese herbs at once. Like, there's like 6 3 times a day, and it fixed everything that I need. Like, I had a cyst, and I took these Chinese herbal tablets for a few days, and then the cyst went away, and it's crazy how it works. But it's so fascinating. And so with the acupuncture, I know that a lot of women have written into us going, I am so scared of needles. I'm petrified to get acupuncture. Does it hurt? And obviously at the very beginning, you're a little bit scared. I've just been poked and prodded for the last 2 years. So needles, I'm like, do not flinch. But for women who haven't had acupuncture, can you explain how it works and how far the needles go in, and what you're actually doing when you're treating someone?
Yeah. So explaining how acupuncture works is a huge topic, but I think for most women, they do want to know, like, pain and all that kind of, I guess, part of it. The acupuncture needles are really thin and small. I do say to women, if you've had a wax before, which is most women, you'll be fine. It's definitely not going to be like that. No. And you two are probably both experienced, as you get used to them, when one goes in, maybe it's a small pinch, like as if you're plucking out a hair, and then, it subsides. Or, sometimes, like, if there's movement or like a very active point, you can have a little bit of tension or a dull aching sensation. The dull aching sensation is actually a good thing in Chinese medicine, because we say that's where, like, the qi is really being brought to the point. It's really stimulating that point. And you've also had things like when, sometimes an acupuncturist or even in massage, they'll come around and prod you, and you feel a point that's like really sore. There's no needle in it, but it's very active. And this is sort of the thing too. But once you have it a little bit, you get a lot more used to it, as you girls would know. If anyone's really petrified, I do have a lot of patients who are needle phobic, and they still come, they enjoy it. Having needles on the front of the body is a little bit more challenging. You feel a bit more vulnerable. But when you turn them over and have it on the back, everyone's usually absolutely fine. But it's just sort of going through that process. If you're going through IVF, obviously, you have to use needles too. So it's this big fear around needles. The needles are so different. And I think it's like how you feel with your practitioner too, feeling safe, or let them making you feel. If people are really scared of needles, I give them a very light treatment to start. So I put not so many needles, and I just, talk them through it if they want. Or I just chat to them, and as we're chatting, I stick them in, and they just don't even really know they're going in.
Yeah, I can't really feel them at all. There's a few in my toes sometimes, like my big toe, and it just like twangs up my toe. I'm like, fuck, that one hurt. That was a good one. But I don't feel them at all, really.
I can never feel them except for one spot in one of the sides of my bum cheeks, and I love it because I know that I must need it. It's doing something there. But I just find it fuck. But I just find it so interesting because every time I come in, you do feel our pulse. You can tell when
I've been doing that lately.
Like, you have that way of telling if someone's pregnant. Like, I remember when I was doing IVF, you were like, I hadn't had my blood test results yet, and you were like, yeah, you are.
Same.
And then you also have a way of being like, oh, if it's on that particular side, it means it's a boy or a girl, and you guys guessed the gender.
Stop it. Really?
Yeah, you can do that, can't you, Jess?
Well, they say you can have a few little hints that you might feel, but look, I've been wrong before.
Yeah.
I get it right a fair bit. You play a game with yourself, obviously, but I can't say that I could just advertise that I can gender pick your baby, because I've definitely been wrong. And I've always thought maybe energetically that baby has more like femininity, even though they're a male. You know, you never know. Like maybe there's a sense there too. Getting a bit woo-woo now, but like, yeah, definitely I do get very strong senses sometimes for some patients, especially ones I know very well. But I have been wrong, obviously.
It's not like you were just like, oh, I think this, I think that. I would probe you and be like, so what do you think that? Like, I'd make you guess for me, and you'd like really feel into the pulse and the side and which one's more pulsier than the other. And I just love that.
I do feel bad for Bonnie sometimes, because obviously I've done a few rounds of IVF, and every time I go, I'm like, so what are you thinking? Can you feel a bleed coming on? What are my pulses? And I'd feel bad, because obviously it's a hard thing. You don't want to be like, no, 100. You don't want to give someone false hope and then be like, well, Bonnie said this and then it didn't work. But
so much pressure.
But yeah, it's so bloody fascinating. I love it. There's so many things that I want to do now since going through what I've been going through. I'm like, I want to be a doctor. I want to be a midwife. I want to be an acupuncturist. I want to learn Chinese medicine.
You'd be great at all those things, all of those occupations. Yeah.
So, Jess, when did you figure out that you kind of wanted to specialize more in fertility-focused acupuncture, and what are other specialties that you could have gone down?
Well, I guess when I first started studying, I always was into the women's health topics that were coming up, and I was quite into the Chinese dietary therapy as well. So that was kind of apparent to me at the beginning. And then it just kind of just grew. When you first graduate, I always recommend to acupuncturists try a bit of everything, because you don't really know, you know, you'll have interests and maybe things you like, but it's good to try things. So I did start out doing everything, and I did treat a lot of, when I was in England, a lot of backs and knees and, you know, shoulders. And, you know, it sort of just developed because I would attract women with hormonal issues. And then fertility became a thing, because obviously I don't just work with women trying to have a baby. It's just to help women reach their fertile potential, which is their overall wellness, because that's what our bodies are designed to do, whether we want it or not. So, yeah, it just became more fascinating for me to get in that area. And I have a personality type where I quite like to know what I'm doing well. So for me to have like all these options and things I could treat was more stressful for me as a practitioner, in the sense like I just like to have a niche area. And, you know, maybe that will change. Like I do have a really big interest in fibroids and thyroid stuff. So, you know, you can go as deep as you want into a specialty area, but definitely a lot of acupuncturists will specialize in musculoskeletal, chronic illness, pain management is another one. So there's a lot of areas we can go into. Some people get really into things like hay fever or like immune response.
Oh, interesting. Paul suffers from the worst hay fever.
Yeah, so there's a big study done by one of my amazing lecturers at uni, John McDonald. He's been in research for a very long time, has a PhD, and he did one on rhinitis, and it actually came back that acupuncture significantly increased, you know, the healing of that, or, you know, worked. So we can actually say that it does help with that, because we're not allowed to say it helps with really any conditions unless it's been scientifically proven, which is really hard to do any kind of studies. You know, everyone's different. Acupuncture and Chinese medicine treat every individual as an individual. So to try and create like a large study where everyone's the same and you do the same points in the same environment and try and trick people that they're having it, but, you know, they're not, is just almost impossible to get a really good result. So, you know, a lot of stuff with Chinese medicine is going to be based around individual cases as well, and like clinic data. So, yeah, it's definitely a lot of areas you can go into, but I do really enjoy fertility and I love working with women. I prefer to work with women. I still do work with men, but probably only like 5% of my patients. And it is harder to get men to come in for fertility. It's ideal if they can. Often I'll actually send them to acupuncturists or naturopaths who deal with a lot more males, because it's nice for the women not to have the same treatment space as their partners as well. It's kind of nice to have separate. So
that's really interesting, because I remember when maybe last year I was getting, like I said, I've been getting a lot of acupuncture, and Bonnie was like, you should really get Paul to come in. It took me so long to convince him to come in.
Yeah.
But he finally was seeing Bonnie for a little bit while he was in Australia, and he would come home. He's like, I'm on cloud 9. He just like, I feel like it's so good for like at a mental level, as well as not just like fertility. I feel like it makes me so much less stressed. If I'm feeling stressed or anxious, or I go into acupuncture and I walk out and I just feel like a different person. I just feel I'm so happy. I'm so light. It's such an uplifting thing. And I love it. I love it so much. It's so, so good.
Yeah. And Bonnie's really good at holding space for people for emotional and mental support. That's really her specialty. Like, she's very, very good at that.
Oh, so. I know. I just want to like put her in a little bottle and take her with me everywhere.
A little bit of Bonnie.
A little bit of Bonnie. She needs to come everywhere with me. She's just, and I feel like as well, seeing you girls, it's such a personal experience. When I've had acupuncture at other places, it's very like, I don't know, would you say like clinical, where they just literally put you on the bed, chuck a few needles in and then piss off for half an hour. Whereas when you come to Nüwa, which is where you girls work out of, it's like you put the needles in, you massage, you're basically almost in the room the whole time. And I go for the massage, I go for the chat. So good.
I'm there for the massage only. It's that good.
Well, thanks.
You guys are like, it's so good.
We still make you get your acupuncture, that's for sure.
Yes.
Still jamming needles in.
Okay, so with acupuncture sort of aside, I want to start speaking a little bit about women's fertility, and a big thing that I can put my hand up and say I knew zero about is our menstrual cycle. And we don't get taught this at school. You literally think that you get your period, that's about it, and you kind of go on. And until later in your life, you don't even really learn about ovulation. But there's so much. I know, like Jess, you could probably speak about this for hours.
Yeah.
But if you can give us a brief rundown of the women's menstrual cycle, what does a normal cycle look like? What are the parameters, and what day of this, like where does day one start? How women can track it?
Yeah. So there's a lot of talk around menstrual cycles. I do get a lot of women coming in worried their cycle's irregular. It might be a few days changing each time, or that they think their cycle's too short or too long. There is actually quite a bit of variation in women's cycles. Not everyone has a 28-day cycle. I think in the course I'd mentioned there's like 15% of women actually have a 28-day cycle. So there's a large percentage where women will have, an other length. And really a healthy cycle can be between, 25 days to 35 days if it's regular. As long as you're regularly ovulating and your body works that way, that can still be a healthy cycle for someone. There's a lot around that, and it's really good to educate yourself or to get guidance with someone so that there's not this kind of anxiety around all these little bits of a menstrual cycle and focusing on that, because really we're just focusing on hormonal health and balance in general, and everyone's going to be slightly different. And the 28-day cycle, the lunar calendar, so, it's orientated around the moon. You hear a lot of people incorporating that into menstrual cycle awareness now, which is a growing area. We do have our menstrual cycle, obviously. And in Chinese medicine, I'll try and integrate the Western and the Eastern together because it can make things a little bit more simple. But basically we have a first part of our cycle and a second part, and then it's broken up into 4 phases. So the first part, a lot of women may be going through fertility or aware of this now, is like follicular phase. In Chinese medicine, this is the more yin phase. So it's really focusing on building yin and blood, because this is where we've got the maturation of our eggs and follicles and rebuilding the lining of the uterus, which was shed when we were bleeding. So that's the first part. And then the second part is, ovulation to our next bleed again, which is known as the luteal phase, which is dominated by progesterone. So the first phase being dominated by estrogen. The second phase is dominated by progesterone. So a lot of women, if they've been going through fertility stuff or listening, they may have heard things like luteal phase defect or low progesterone. And this is where they're kind of looking at that for getting pregnant. If you do conceive, if your progesterone, or in Chinese medicine, the yang is not strong, then we have a risk of early miscarriage. And that's just because the body is going to struggle to hold the pregnancy. So breaking that down again, we've got menstruation, which is when our body is shedding the lining of the uterus. And this is due to our hormones dropping because there was no pregnancy or conception. And then we have the follicular phase, so the maturation of the follicles and the lining building. So we get a rise in estrogen and a rise in LH hormone. So if someone's using ovulation predictor kits, those ones are going to detect the rise in the LH hormone. When we reach the next phase, it's ovulation, which is where everyone trying to get pregnant is going to be focusing on and watching out for. This is like your prime time, your fertile window. And then this is the most yang part of the cycle. So we get a real big surge of hormones, and we're building the yang, and then an egg is released from the follicle. The follicle then breaks down and it becomes its own endocrine body and starts producing progesterone. So when we have a good ovulation, or efficient ovulation, then if we're conceived, that progesterone will keep up and it will stay up and you'll be pregnant. And if not, the progesterone stays up for a period of time, which is your luteal phase length, and then it will start to drop and then you'll bleed again. So you've got, menstruation, follicular phase, ovulation, and luteal phase, or implantation phase it can be. So that's kind of your map of your cycle. And these phases will be different for every woman. Some women might ovulate day 12, some day 19. The biggest thing I see in clinic is women who maybe have an attempt at ovulation and then it doesn't happen, and then they have a later ovulation, or that they thought from an app or just from what they'd heard that they ovulate day 14 because they've got 30-day cycle, but that isn't necessarily the case. Some women will actually ovulate, day 18, 19, and for a 30-day cycle, that's still perfectly fine. So they'll stop having sex after, day 16 and they've missed their window. So this is where cycle tracking can be so advantageous with Chinese medicine, because we've got some practical homework for women to do and to tap into their own body. And then we can use Chinese medicine to, try and balance any imbalances we find within the tracking, or through blood tests and other things that we can use. So that's like your little overview. Day 1 of your period, which I do remember you said. So I definitely correct this often in clinic. Spotting is not your first day of your period. Okay. So if you're having like 3 or 4 days of spotting, this is when your progesterone is going down, or maybe you have lowered progesterone, or there's something that we can maybe look at there. The day 1 of your period is the day when you have fresh blood, and they've sort of made it universal that it's got to be before 12 o'clock in the day. Like if it's an afternoon arrival or a nighttime arrival, you'd count the next day as day 1.
Yeah.
Yeah, I've heard that too. No, that was a massive one, and I think for heaps of people, finding out the exact time that you ovulate, because those things you pee on often aren't right, and then sometimes the temperature thing's really hard to get because you're measuring your temperature at slightly different times. And it was you, I remember, I was like, no, I ovulate on this day, and you're like, no, mate, you probably don't. You're probably getting it wrong every month, and that was super helpful for me. But what I want to talk about, because I know there's different types of foods that are beneficial to have during all those phases of the cycle that you just mentioned before, that fuel your body for different stages of that. So can you talk about those different foods and how they can help?
Yeah. So rule of thumb in Chinese medicine, we never usually support having lots of raw cold foods, just in general for women's fertility. As you girls have probably heard us say, broth, soups, stews. So as a rule of thumb for everyone listening and, who want that information, we always usually say like 80% cooked, 20% raw. Well, that's how I usually pass it on, because we still want to have some fruit and some, salady elements in our foods. But I always say good example is like if you have like a Japanese meal, they often have like a little bit of salad with like the horseradishy dressing, and then they have like a miso soup and some rice and some veg and some protein and pickled stuff and a bit of hot stuff. So they have every flavor. So the more that you can incorporate every flavor, like sour, astringent, a little bit of spicy, sweet, salty into your meals, you're getting like a really good balance. And this is why if you look at a lot of Asian foods, they kind of have all the herbs they put in, ginger, cinnamon, star anise, turmeric. Yeah. So I do encourage everyone to sort of cook with that, using lots of colors, lots of variety, and the 80% 20 rule. So if you do that throughout your whole cycle, you pretty much, it's going to be good, right? But we can vary, like just slightly change in each phase too. So menstruation, you're losing blood. You need to make sure you're having good iron building foods and good slow release carbohydrates so that you're feeding yourself, because your body is shedding the lining and then it's going to want to rebuild, right? So we do need to nourish it. If Chinese medicine is not at all vegetarian or vegan, I will just put that out there. So we do encourage a lot of bone broths, organ meat, which, most people can't have and you can get in capsules. These sort of products are going to be really good because they're giving you good fats and really dense nutrients, and they're building iron, right? Green leafy vegetables, lentils, beans are also great. So if you are vegetarian, you just got to make sure that you're getting good protein. I do encourage eating eggs as well, organic. Always try and get organic, not chemical or hormone fed. And a little bit of like anti-inflammatory. Also, we'll avoid stimulants, so like your coffee and alcohol. When you're shedding your lining, you're kind of having a bit of a detox. Like, you just want to support that process. You also just like adding turmeric is a nice one because it's anti-inflammatory. So if you're getting pains and discomfort, definitely adding turmeric in can be a nice way of doing that. Ginger, garlic, all these nice sort of warming, stimulating, chi moving, or we say energy moving foods. Another little thing not related to diet, but I do advise if you're bleeding to try and not wear a tampon, because we want to encourage a downward motion of energy and blood, and not like putting something that's going to stop it. So even if that seems impossible because of your lifestyle, try at least day 1 and then try day 2 just to wear a pad or period undies, always making sure organic. That's another good one. And just really
what about the cups? Sorry to cut in.
No. Like, look, cups, it's halfway point. It's good to actually see what your blood is like.
Yeah.
Sometimes I am wary with them because when women pull them out, it can create like a little suction action.
Yeah, it does. And
it's still putting something up. If you're having any clots or you can still see your blood quality, on period undies or on pads. But I just prefer women, especially if they're getting clots or very like thick, dark blood, just let it come out, like let it shed, try and get it out. If you've got endometriosis or anything like that where there's retrograde blood going, back up in, just try and let everything get out. Your uterus is doing its best. It's contracting to try and get it out. Plan A is basically the uterus just contracts and the lining sheds easily. Plan B, when it's not working, it really starts to get in there, and this is where it causes pain. So anything we can do, heat packs, nice anti-inflammatory herbs, and that stuff you can find in your, grocery shop or, the market. So turmeric being a big one. Parsley is good. Mint is good. Rosemary is great for circulation. So we've got a lot of tools we can use at home as well. We don't always have to have other things, but definitely we want to encourage flow because that's what's happening.
I've always been I feel like growing up, it's always been tampon, but it's only probably the last few months, the more I've become so interested in the female body and what we're doing and the different types of our cycle. I feel like I remember seeing girls that would wear a pad and I'm thinking that is the grossest thing ever. Have some hygiene. Seriously, I think that I'm that is absolutely crook. And then the more I learn about this and the more I learn about different what to look for in your blood and clots and all that sort of thing. At nighttime, sometimes, like you said, through the day, it is convenient. I sometimes wear the cups, but sometimes I find it really hard to get them in. I really struggle. and then they leak, and then you end up finding you're having to wear a liner with it anyway. So I'm like, that's just pointless. But at nighttime, I generally would try my best to wear pads at night, just so I can like look at the blood and look at what the different colors and if there's clots coming out, and really trying to analyze my cycle as best as I possibly can. And I actually really like it. I'm so interested in it. So it's like, it's really intriguing to see what's happening each month and see the difference between one month to another, and you can really notice a difference and it changes.
Yeah.
And it's good to look at your cycle, because you can diagnose a lot from the menstrual bleed, you know, like what the color of it, the blood is like, is there clots, is there mucus, is there fibrousy tissue, is there, you know, like how long is it going for, how much blood. So cups, like I'm not anti-cups, but I just find that a lot of women like yourself have issues putting it in, maybe get like a bit of irritation. And also, I guess they came out as well thinking of the environment, because, you know, we have to think of that as well.
And we wanted to speak about cervical mucus and normalizing it, because it's a thing that people, you're like, oh, yuck. But it's just like your period blood, that you can learn so much from it. And I'm becoming, again, more and more interested in the different times of the month and the different cervical mucus that's coming out. And it's not it shouldn't be seen as a gross thing. It's so normal. And do you want to talk about it?
The best way I explain it is kind of, you know, we do have a fertile window. There is a type of mucus that comes out during that time, cervical fluid, that can only come because we actually have a mucus plug blocking the cervix. So that's when you're not fertile. Like you can't, there's no sperm's going to get in, like there's going to be no fertilization, there's no egg released. This plug dissolves when we bleed, because obviously the blood has to come out. It reforms, and then we have an infertile phase, you know, through our follicular phase when the follicles are developing and the lining's building. And then as the hormones change, we have a dissolving of that plug again. When that plug dissolves, we have the cervical fluid is able to come out. And this fluid is the most, you know, the one that we really want to look at, and that's more lubricating. So for a lot of women, it can be different. You hear it being said that it's the egg white, but not every woman it's egg white. Some it can just be more, can be a little bit more runny, or it can still be a little bit creamy, but there's usually more of it. And if you're not getting any changes in mucus, you know, there are some drugs that get, you know, that actually prevent mucus, or, you know, like clomiphene or Clomid, is one. Like if you're on Clomid, you might notice your discharges getting less and less, because that's actually a side effect. And but it's basically looking for this change of an infertile pattern being, you know, you might just have a little bit of creamy mucus, not much. When you wipe, when you go to the toilet, this is a good description, it doesn't really glide. When you are fertile, or even if you've been aroused or whatever, you have like a more lubricating fluid. So if you wipe, it sort of glides through. And a lot of women, when I talk in clinic about it, they can relate to that. Or if I say that, they'll get it when they do actually try and look for it.
Yeah.
You can notice on undies too, but some women get that the whole way through their cycle. Some women in their infertile phases don't really have any mucus at all, and it's like quite dry, like noticeably dry. And then other women have a mixture of dryness and like a little bit of, you know, mucus, because that mucus does get secreted from the vagina as well. But when we have the fertile phase, so that plug is dissolved, the mucus from the cervix can come out. It actually helps to suck the sperm back up. So it's under a microscope, you can see it's a different kind of mucus, and it's produced in a different area of the body. So it actually helps facilitate the sperm to swim up, and it does have a sucking action. So there has been women who've gotten pregnant from non-penetration. Wow, so where they've been ovulating and maybe they've had a pull-out method where their partner has ejaculated on them and it's gotten to the external genitalia, and the cervical fluid has actually sucked the sperm up.
Wow.
How crazy are our bodies? What the hell?
So this is your key, you know, to getting pregnant, is really looking at mucus. And you can take temperatures, but the problem with the temperatures is once it's gone up and set up, you kind of miss you. It's a bit late.
Totally.
So if you're going to use temperatures, like I say to patients, use them alongside mucus tracking. And if you want to do cervical checking as well, you can put your finger up and actually check your cervix. You can...
I did that one. That one worked for me.
Yeah, and that's
you would feel where the the cervix was if it was low and soft and stuff.
Yeah.
I found that so interesting.
Yeah.
That helped, yeah.
And it's just what people are comfortable with doing, what women want to try, you know?
So when trying to conceive, there's different pressure points for acupuncture that I'd love to hear about, and also how these spots can help thicken endometrium lining and making it and especially for IVF, making your lining thick and sticky for implantation. Can you talk about that?
I mean, there's quite a lot of points sort of locally on the belly. There's also, like you said before, sometimes you feel the ones on your feet. Unfortunately, there's some wonderful, beautiful, poetically named acupuncture points for fertility on the feet and the hands that are not in nice places. And this is something we use, distal and local points. It's probably easier to put, I don't even know if you guys can put a PDF up with acupuncture points, but it's probably easier to have visual descriptions and diagrams, because, there's a few on the belly. For home, trying to get your lining thickened or blood flow into the uterus, I really do love sometimes sending women home with moxa, or, using heat packs, castor oil packs, self-abdominal massage. They're really good, because without the needles, it's going to be harder for some of those points to have pressure, whereas it's actually nicer to massage that whole area of your abdomen, because you just do need this good calming and all the way up in the diaphragm. It can really detoxify the area. So there's a lot of things there, and herbs, and using your diet, because your body needs the nourishment. So yes, acupuncture, the needles will help increase blood flow to an area, or they can reduce things, unblock blockages. However, there's so many tools I would give women before acupressure at home, herbs, diet, lifestyle, self-massage, castor oil packs. Womb steaming is another one, or yoni steaming is a big thing at the moment. I do prescribe to some women. I think you did one, didn't you, Ellidy?
Yeah, I did a few. You gave me a few. They were epic.
So they're great. And when I was talking to things about when you don't do it when you're menstruating, you can do it before or after, and then you would never do it after ovulation if you're trying to conceive. But you can use herbs in there to help promote circulation, to help detoxification, anti-inflammatory. Yeah, so I can definitely somehow make a little PDF for people to download if they would like, if that's something you guys can do on your site, that just has some points if they want to. But I say self-massage is a really great one, and the heat pack, and even just self-massage, as simple to describe, is just using a really nice oil, whether it's coconut oil. If you have essential oils you like geranium, rose, jasmine, all those nice feminine ones. Or if you've got pain, you can use some for pain, clary sage, that kind of thing. Just do clockwise motions all the way down to your pubic bone, which literally is quite low. You'll feel it. This is where your uterus is. Yeah. And then all the way up to your ribs, into your diaphragm. Just do clockwise motions, and you'll intuitively kind of, go there and massage. And then just don't, if an area really hurts, don't just hone on in there and really get in, because it could be too much. But yeah.
And we probably should disclaim that there's going to be certain methods or herbs and oils that are for certain phases of fertility, or whether you're pregnant. Definitely don't just go rogue and try to a womb steam or use any oils at any time.
There's no womb steaming. No womb steaming in pregnancy. And, abdominal massage, women are going to massage anyway. As you probably know, you want to not get stretch marks, so you can massage your belly. It's fine. Your intentions aren't to do any harm. You just be gentle with yourself. But this is why if you've got some full-on conditions, or you've been diagnosed with things, getting some advice from a health practitioner is good to start, and then you can start doing the practices at home. And this is something I find in clinic. I'm trying to make something online so that I can just educate women in those practices, because they're very helpful at home, rather than always having to see a practitioner, or see a practitioner to start. And then, when you're feeling more balanced, you just carry on with those practices at home.
Oh, I just love talking about these topics. I could seriously talk about it all day. And I really hope our listeners have got a lot out of this. I mean, even though I just learned about most of this 2 weeks ago, I feel like I'm still learning. Every time you speak, Jess, I'm like, wow. But I feel like before we wrap this up, I wanted to, and this was actually a question that one of our listeners wrote in for you. And if you can't think of it off the top of your head as well right now, then we don't need to worry about it. But do you have any like one particular, like what is the most powerful testimony or healing miracle that you've treated or witnessed when it comes to a person that you've treated through acupuncture and Chinese medicine? Do you know anything off the top of your head?
Look, I've got lots, and I'm not going to say this is my doing 100%, but there is one person that comes to mind, and I almost feel like I might have told you about her, Ellidy. I had a lady who's a beautiful, beautiful woman, was single, went through IVF. She wanted to have a baby in her early 40s. She literally went through everything. Like, I'm talking any kind of thing, saw multiple specialists. I can't even remember how many rounds she did. It was like really up there.
Yeah, I think you told me, wasn't it like 17 rounds or something?
Something, yeah. I cannot remember off the top of my head, but just I loved her a lot. I actually treated her for nothing for a while because the expenses for IVF were just intense, and she wanted a baby, and she just kept trying. She just had so much hope. Tried her own eggs, wasn't really working. Obviously, she used donor sperm the whole time. Changed donors of sperm, because even choosing sperm donors, I always say, check if they've had kids in the last 5 years, because you're going to know if they can make a baby more than just like young and, fit and healthy relatively, because you don't really know. And she went through everything. Then she did donor egg. Then she did donor embryos multiple times, like just everything. And then I still remember getting a message. If she listens to this, she'll know exactly who she is. I still remember, I think it was New Year's Day or something. I got a message from her after all these years. I think it was like 4 or 5 years, and got a message from her with a double line on a pregnancy test. And, I was just beside myself. I think I was telling patients, you know what, my patient's gotten pregnant. Everyone this year, it's a good year because, she's gotten pregnant, setting the bar.
Wow.
And then the next part of the story that's really exciting is when she had her scan, she had twins, and she's had twin boys.
Wow.
And I haven't even met them. I say I'm a disgrace because I adore her, and I've been trying to catch up with her at times. She lives up a bit more north now on the Gold Coast, but she's 2 beautiful, healthy boys. And I just couldn't have been happier for her, because after all that, I think we used to joke that she'd just have twins or triplets, and it was just never, she'd only been pregnant once and lost it, and then nothing else really.
Wow.
Yeah. And now she has 2 beautiful little boys, and that's probably still one of the stories. And I've got so many, but that was just one, because she's doing it on her own too. Not just going through IVF, but on your own for so long, having so much faith, just keep persevering. Yeah. And that's where I say to women, if you really want a baby, you will get there. It just doesn't always look the way you think. She didn't end up with her own egg. It was embryo donations.
Wow.
And, if you really want a baby, you will go through whatever avenue you need to get there. And I can almost guarantee that if you have that perseverance and it's in your heart to do so, you'll end up with a baby. Maybe it would be through donor embryo. Yeah, maybe. Yeah, exactly. Maybe 2, or maybe it'd be adoption. Who knows? But if you've really got that drive, it'll be there. And that's the drive you want from a mother too. You want to, look after your cubs. You want to be there. You're like, this is it. So that's probably the one I think of. I've got many. Even your story, Ellidy, is amazing. I've got so many stories.
That chick's amazing though, because I'm always hanging out with Minnie, or if she's, having a moment, I'm like, oh my God, imagine if there was 2 of her, how would I do it? Because there's only one of me, does that beautiful woman have some good support around her?
Yeah, great support, and she's so happy. But she had an apartment close to here, and she was like, I'm gonna have to sell my apartment. And I was thinking, why? What are you talking about? And she's like, how will I get twins up the stairs?
True.
Oh yeah.
And I was like, well, you can't leave one in the car in the garage and run up and go back down. Literally. So yeah, I was like, I didn't even think of that. So that's why she moved. She ended up selling the apartment and going north and a little bit more, and I'd love to see her soon, because I do see her Instagram posts, and she was very active on IVF pages. She would happily, if I had other people going through really rough times, she'd always happily offer to get a coffee with them and chat, because she'd literally been down every possible avenue. She just knew doctors and nurses by names, people, she was in community groups. she was like, she was always out there trying to help people.
It's a crazy club.
It's a crazy club. Yeah.
So glad she finally found you, and like I reckon you got her there, obviously.
Well, I was support in one way, but it's because she had the determination. Like she just knew, and every time she was like, "This is the last round," I was like, "Okay," and then it was like another one more. So yeah, she's a beautiful inspiration, I think, to women, and she's so happy now, and her boys are just beautiful, healthy boys. So yeah, like even for you, Chloe, and everyone, like just if it really is what you want, just like persevere, you'll get there. And then you'll have the story of seeing other people being like, I remember that was me, it'll be okay. People look at you like, whatever, I don't want to hear that. But
I know it will happen.
It's good. Thanks for having me.
Thank
There's
you
so much we could have talked about.
I know. I seriously.
We could go forever.
We need to do like a part 2 just for the last part of the cycle.
We'll definitely do a part 2 and we'll get Bonnie on too, both of you. Good.
I feel like we should get Bonnie on for sure.
So Jess, to wrap, do you have any recommended readings, and can you also please tell our listeners where they can find you?
Yeah, so recommended readings. There's a lot. I really love the Chinese medicine-based one by Hang Oh, I think her name is. I can't pronounce. I feel terrible if that's wrong, but I can somehow write it up. But Awakening
We'll chuck
Fertility.
it on the show notes.
Yeah,
Sorry,
Awakening Your Fertility is great.
Mm-hmm.
I really also recommend a lot of patients to read or listen to any of Dr. Libby's stuff. She's got one called Rushing Woman Syndrome, and it talks about the busy woman in a modern day life and how that actually affects your hormone.
Wow.
Beyond the Pill is a good one as well, which is more about like when you've been on the pill for a long time, trying to come off of that. The book is really informative and great. There's a heap I can recommend. You
actually have a whole list from the workshop, so maybe I can actually share. I'll take a photo of the PDF and I will share it on our Facebook community. So if anyone that's listening that really wants to have a look at these readings further, I'll share it on there and I'll pin it to the top of the group so you guys can access it and do extra research.
Perfect. And do you know what we should do? We should get our Facebook community together and kind of gauge some interest and potentially even host another workshop with you, Jess.
Yeah, I would love to. And, I am for many years I've been trying to do things where I could do online consults or online courses and it's still a very long process. I don't like being online very much. But
Jess said before this is her first time using Zoom, and I was like,
well, not Zoom, but what is it, Zencast? I was like, oh,
okay. I guess it's not exactly Zoom.
But you know what? I've used Zoom a few times, and I always struggle every time.
No, don't worry. I struggle too. I like in person. I don't want to talk to people online or over the phone. I want to see them face to face. I want to hug them. I want to talk.
Yeah, technology challenged. That's what I am. Probably always will be.
You're the best. Thank you so much. And it'd be sick to do a workshop with you and like a bunch of our listeners. They would freaking love it, I reckon.
Thanks, Jess.
Thanks, girls.
Love you.
I can't wait to come back up and see you and get touched.
Yes, come. We miss you.
Welcome to our Asking for a Friend segment.
Yes, asking for a friend. You ask, we tell, right here, right now. So if you have a question, you can head to the link in our bio on Instagram, or we'll put it in our show notes. Send us the questions and we will answer them for your ear holes. Ellidy, this one is for you. Help, I'm pregnant and a single mum. How on earth do you do it, Elle? Is motherhood harder than you imagined?
Fuck. Close your ears, Minnie. Fucking hard, bro.
No, she's an angel.
Look, good question. What I've realised since being a mum is I thought that mums, like I've always looked at mums, but they're super mum. They fully know what's going on. They've got it down pat. And what I realised is no one knows what the fuck they're doing. I mean, look, Minnie's she's 4 months old, and I still don't really know what I'm doing. I just got to keep her alive. I just honestly, I feel like, but you know me, I'm not too much of a stressy person. And she's coming on. The best thing for me is that we have been like down to Sydney and everywhere because of what else has happened in my life with like dad and everything.
Cute.
And hello, Minnie. And she's just like, I know I say this all the time, but we're not at home like doing the normal things that lots of mums do. Like I'm not on Minnie's program sorting out when she's feeding, when she's sleeping and da-da-da-da-da. She's just coming on my program. And so she's napping when I want, when I'm out and about, whenever she wants. We don't have a set routine and set places. She sleeps really well. She feeds really well. I'm really lucky with that. But what I would just say as a, like, I mean, I know nothing. I feel really weird that someone's like, you know, giving advice because I don't know what the fuck I'm doing. But I think the early days, I guess, would be just going with the flow. Like I think I'll get into a routine in a few months where I'm more like regimented with her. But at the moment, I reckon she's learning so much about just adaptability by just coming on our cruisy life wherever it's just taking us. And what do you want to say, Minnie? She wants to say, fuck this podcast off. Let's go to the beach. I have a question for you. So I think lots of people want to know, but someone wrote this in. How do you foresee your life with a bub when it happens for you and Fish, Chloe? Like, is this baby just going to come on tour? What's the go?
Oh, it's for sure going to have to be a tour baby, 100%. I was actually just saying to Paul the other day, I was thinking, when I'm pregnant, am I going to be able to go to like nightclubs and stuff like that or festivals, or am I going to have to stay at home? And he's like, you're 100% coming. I've seen people pregnant at shows for sure. I actually have seen pregnant people at shows, but I said, what is it like? Is it going to be like bad for the baby's brain if I'm standing next to like a speaker the size of my body just thumping? It's going to like come out of the womb going, I fucking hate this, or I love dad's music. Imagine if it just like it's going to have no choice. We speak about this a lot, but it's going to have to just go on the road. It's just going to have like there's no way I'm staying at home and not experiencing the world like we usually do. Like you said, with your question, you just have to, the baby has to come with us. Yeah. And that's just the way that it is.
Just give it little ear muzzle things.
It will definitely have it'll definitely have ear things, and then I don't know what we'll do. I don't know. It'll come. It definitely is obviously not coming to nightclubs and not coming to festivals. But when I'm pregnant, I'll for sure try and go to some stuff that I can. But next time when Paul plays at Coachella, hopefully next we'll have a baby and the baby can come to Coachella for sure. I've seen kids at Coachella.
What about like I'm sure there's some sort of soundproof belly
That's what
wrap
I wanted
or something.
I thought that I wondered if we could do something like that, like a wrap around the belly that like
that's a good idea.
What is it? Deters sound. But
I feel like we're the same. Like we're just gonna, because our lives are pretty crazy, we're just going to get on with it, like with our bubs. Like Minnie's on tour, she loves it, but your tour is going to be way more hectic because you're like going to be on planes going overseas and everything.
So that'll be fun.
Your kid's just going to be such a little legend.
It would hope. It would want to be. Anyway, that's it for today. Thanks, guys.
Yay.